Each month on Smart Medicine, we give you the chance to ask the expert. This month's topic, hypertension. Joining me now, cardiologist Dr. Ari Shutkovsky. And Dr. Shutkovsky, thank you so much for joining us.
Thanks, Joe, for having me here.
How do we define hypertension today?
Normal blood pressure is considered 120 systolic over 80 systolic or lower. There's now a new category called prehypertension, which we now believe has some implications for risk of developing complications, and that range is from 120 to 139 over 80 to 89. And then there's a stage 1 hypertension, which used to be mild hypertension, that is systolic of 140 to 160 and a diastolic of 90 to 100. And then there's stage 2 hypertension, which is considered severe, greater than 160 millimeters of mercury and greater than 100 millimeters of mercury diastolic.
What causes hypertension?
There are several different mechanisms that contribute to hypertension. One of them is activation of the neurohumoral system. These are hormones in our body that increase our catecholamines and increase the adrenaline that's in our body. There's also a portion of hypertension that's caused by hormonal increases supplied by the kidney, angiotensin converting enzyme, angiotensin. Some of it is also linked to obesity. Some of it is linked to alcohol intake. Some of it is linked to genetics, but nobody really understands what the exact causes of hypertension.
Can it be treated behaviorally?
Absolutely. The first thing that every physician should recommend to their patients is behavior modification and lifestyle modification, and that includes watching your sodium intake, which is definitely linked to increases in blood pressure. We recommend about 2 grams of sodium a day or about 6 grams of sodium chloride a day. A well-balanced, healthy diet, lots of fruits, vegetables, fiber, fish and chicken. Exercise daily, at least 30 minutes of cardiovascular training daily. Weight loss is important. Decrease your alcohol intake.
If exercise and diet don't work, what is the next step?
Depending on what your blood pressure is, your doctor should determine when he diagnoses you with hypertension whether or not lifestyle modification is adequate enough or whether or not he should initiate medical therapy. There are all sorts of drugs, different classes, that work on different mechanisms in the body to control the blood pressure. And there are recommendations as to which might be the right drug for you.
Thank you, Dr. Ari Shutkovsky, very much for this insight.
Thank you.